Nicole Deschamps. I'm a speech language pathologist, and I've been working in this field for almost 26 years. I chose the profession of speech language pathology because I really wanted to help people and wanted to work in the healthcare field. So speech language pathology is an allied health professional, very similar to occupational therapy or physiotherapy. And basically the way I got there is I did an undergrad in a science degree. So I had a major in biology and a minor in chemistry, as well as a minor in psychology. Then at that time I really didn't know what I wanted to do, so I started a master's in biology. And when Laurentian University started a master's of speech language pathology the following year, I switched over into that. So a speech language pathologist is a person or is a profession that works with people that have either speech difficulties, language difficulties, or swallowing difficulties. A lot of people don't maybe realize that speech language pathologists are the ones that typically will do swallowing assessments and are the ones that will advise physician as to what types of dietary restrictions or textures that the person is safe to be eating orally, or whether or not they need to remain tube fed or not. So it's also a career that provides the opportunity to work in a variety of environments. You could work either in schools, you can work in hospitals, children's treatment centers, or even your own private clinic. It also provides the opportunity to work across all life stages. So depending if you have a greater interest to work with children, it's a career that would allow you to do that. So you can work across all ages, including babies, toddlers, preschoolers, school-age kids, adolescents, and adults of all ages as well. There's different client populations that a speech pathologist can work with. So children that are born with congenital syndromes, developmental delays. Some examples are children with autism or cerebral palsy, working with adults that have multiple sclerosis, Parkinson's, ALS, adults that have suffered strokes or brain injuries as well. So in general, a speech language pathologist would work on things such as speech, which includes articulation problems, fluency difficulties, so someone who has stuttering, as well as voice problems. So either someone who had their larynx removed, so somebody that would need help to regain their speaking voice, and overall communication as well. So someone who's nonverbal, who needs a communication device to help them communicate. And again, work with people that have swallowing difficulties. So in order to become a speech language pathologist, you have to have a master's in speech language pathology in order to work in Canada. And in Ontario specifically, you need to register with the College of Audiologists and Speech Language Pathologists of Ontario. There are various universities in Ontario and across Canada that offers this program. And there's also a bilingual program as well at Laurentian and the University of Ottawa. So after I did my undergrad in science at Laurentian, and I had started my master's at Laurentian in biology as well, I switched over to a master's of speech language pathology at the time it was a joint program between Laurentian University and the University of Ottawa. For day-to-day work, I guess that would really depend on the environment that you're working in. So if you're working in a school, you would be doing assessments, working with children and doing assessments of their language skills, providing treatment, therapy sessions, as well as some training and suggestions for the classroom teachers so that they can implement those strategies in the classroom. If you're working in the hospital, you might be attending various rounds, medical rounds on the various floors. You might be working on a rehab floor, working with people that have had a stroke or brain injury. You might be working on an oncology floor, and mostly working with swallowing difficulties. So again, really depending on the environment or the, I guess, the client population that you're working with, your day-to-day would be significantly different. And that's the great thing about this career or this profession, is that you do have a lot of options and a lot of variety of the settings that you work with and the client population. So for the first 3 years of my career, I worked at a hospital in a rehab wing, and mostly worked in with clients with swallowing difficulties. And we also started an augmentative communication clinic for adults. So for adults that had significant communication difficulties that needed a communication device to help with their communication. So I worked in that clinic for a while. And then I worked at a health unit, and they had the preschool speech and language services. So then I worked with preschoolers, so 0 to 5 or 6. And then after that, I worked at a children's treatment center. I back again into an augmentative communication clinic that served both children and adults. And I worked in that program for over 20 years. And just recently, I moved into a management position. So again, lots of opportunities for future opportunities and personal growth and advancement as well. All right. Well, good luck, everyone. Take care. Bye-bye.